Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau. Finally, someone willing and able to blow the top off hidden healthcare and hospital dangers. She's provocative, upbeat, balanced, fearless, fresh. Pat has over 20 years of experience as a professional public speaker and knows how to approach this important subject with enough humor and wit to keep you informed, entertained, and empowered. Each week you will say, "Oh," as Pat explores and exposes little-known hospital hazards, delves into the deep waters of dangerous healthcare practices, picks the brains of her good-looking and influential guests to help keep you and your family safe in today's fragmented healthcare system. The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, and I will be your hostess, your one-stop patient safety radio hostess, where I will spend the next hour serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit. After all, that's what a good hostess should do, right? Well, today we have another fun-filled and fact-filled hour just waiting for you, our favorite listeners and friends. You know, it's a privilege for me to put this weekly program together because I hear from so many of you about your personal healthcare journeys and how we are helping you to find your voice and speak up. So I thank you for listening. And right now, I encourage you to sit back, prop up your feet, take a deep cleansing breath, and enjoy this very important time with us. And to get started, now it's time for the healthcare hazard of the week. Today it's MRSA. Because October is MRSA Awareness Month, I thought I'd take advantage of that and go back to discussing a good old hospital hazard. Actually, MRSA is not only found in hospitals, but also nursing homes, rehabilitation centers, and even out in the community. Gyms, spas, schools, dormitories, daycare centers, and even in hair salons. So, what is MRSA? MRSA. It's an acronym for methicillin-resistant staph aureus, and it's a type of a staph bacterium that is resistant to a type of antibiotic called methicillin, and it's often resistant to other antibiotics as well. Staph bacteria are normally found on the skin or in the nose of about 1/3 of the population. If a person has staph on their skin or in their nose but they're not sick, they are said to be colonized but not infected with MRSA. Healthy people can be colonized with MRSA and have no ill effects. However, they can pass the germ to others. Staph bacteria are generally harmless unless they enter the body through a cut or other wound, and even then they can only cause a minor skin problems in healthy people. But in older adults and people who are ill or have weakened immune systems, ordinary staph infections can cause serious illness called methicillin-resistant staph aureus or MRSA. In a healthcare environment and among already ill or immune-challenged patients, this can prove deadly, or at the very least may include surgical wound infections, urinary tract infections, bloodstream infections, and pneumonia. If a person is colonized, they have an 8 to 12-fold chance, a greater chance, of getting an infection. Now, staph and MRSA can also cause illnesses in persons outside of the hospital and healthcare facilities. As I just mentioned, people who are colonized with MRSA have no symptoms. They can carry it in their nose and on their skin for many years. Staph infections often begin with an injury and develop into an infection and then can be shared with others in the community. You may have heard about athletes passing MRSA on to fellow athletes via contaminated equipment, towels, and so on. This cross-contamination can really occur anywhere: work, school, grocery stores. And this is one of the reasons why I am so against healthcare workers wearing scrubs out in public. Who knows where they've been, what their clothing has touched, where they're going. I just think it's the prudent thing to do. Change your clothes. Several drugs continue to work against the community-acquired MRSA, but even MRSA acquired in the community is rapidly evolving, and it may be a matter of time, too, before it becomes resistant to most antibiotics. So, what are the symptoms? Redness, warmth, swelling, tenderness of the skin, and boils and blisters. Some start out looking like small spider bites. Some people may have chills and fever, feel nauseous and acute pain, in addition to fatigue and headaches. So, how exactly is it spread? MRSA can be acquired by direct contact with an infected or colonized person and contaminated objects. We've talked about this many times on this program, about the lack of proper hand hygiene amongst medical staff and the ability to contaminate and recontaminate surfaces such as the TV remote, tray tables, bed rails, the privacy curtain. These lapses in infection control happen frequently in hospitals, in rehab facilities, nursing homes, and have been increasing in alarming rates for decades. Each year, more than 18,000 American patients die from MRSA infections. That number equates to more deaths from MRSA in the United States than from those who die every year from AIDS. But you don't really hear about that much, do you? Therefore, as I always preach, patients must insist that the healthcare workers wash their hands first and then put on gloves before touching the patients. So who is most at risk? MRSA can cause infection in healthy and ill patients of all ages, but especially in patients over 65 years of age, patients coming from a nursing home or another healthcare facility, those previously colonized or with current MRSA infections, those who have been in the hospital in the last few years, intensive care unit patients, surgical patients receiving implants, those on a catheter, dialysis patients, and possibly in the air in the case of MRSA pneumonia. And staph infections are especially dangerous to those who have had surgery and may have a cast or a heavy bandage that's not changed frequently. So how can you prevent infections and protect yourself while in a healthcare facility? Here are 7 tips. Number 1, if you're going to have elective surgery, such as hip or knee replacement, call your hospital and ask them what their inpatient MRSA infection rate is for the previous year and what the infection rate is for surgical site infections. Now, they may or may not tell you, but it doesn't hurt to ask. Also, ask them what their hand hygiene compliance rate is. There needs to be transparency, and this information is not always made public, but you do have the right to know. Number 2, if you know you're going to have surgery, ask your doctor to test you for MRSA, which is done by a simple and painless nasal swab. If you're tested positive, you can be decolonized by taking 5 days of an antibiotic spray in the nose and also by washing the skin at least twice a day with a soap called chlorhexidine, and that can be purchased at any drugstore. And as I mentioned before, if you are colonized with MRSA, you have an 8 to 12-fold greater chance of acquiring an infection, so be sure to ask for this test. Number 3, make sure that all family members who enter your room wash their hands as they enter and as they leave. And if they're going to be sitting there looking at you, ask them to put on a pair of gloves, have them grab the bleach or disinfecting wipes, and have them clean frequently touched areas such as bed rails, TV trays, the remote, the phone with those disinfectant wipes. And if you're visiting a loved one, make it a point not to sit on their bed and make sure that you wash your hands thoroughly after leaving the hospital. Number 4, insist that all healthcare workers, and this includes doctors, even though they might look scary, ask them to wash their hands and put on gloves before they touch you or the patient. Putting on gloves without washing hands first contaminates the gloves. And then they should wash their hands again before leaving the room. Number 5, when going to your family physician or your doctor for a visit, insist that your doctor washes his or her hands before examination, and also insist that the stethoscope be wiped down with an alcohol-based gel before placing it on your skin. Number 6, if you or another loved one does contract an infection while in a healthcare facility, ask your doctor what type of infection you have. If they tell you, oh, it's staph, ask what type of staph. You need to know what type of organism it is. 70% of all staph infections are MRSA. The majority of doctors still don't tell patients or their family this information, so insist. And finally, number 7, upon discharge from a hospital, you or the patient should receive discharge information on MRSA that will help to explain how transmission can occur, what to expect, and how to look for symptoms of change. This is very important. And now let me briefly get to a couple of ways to prevent infection and protect yourself while out and about in the community. Here's 6 quick ideas. Number 1, keep all wounds and cuts cleaned and covered until healed so germs cannot enter. 2, do not share personal items with others, such as towels, clothing, razors. Number 3, when at a gym, refrain from touching your face or wiping your face with a towel that has touched surfaces. Wash your hands thoroughly with warm soapy water and do not touch surfaces on the way out of the gym. You don't know who's touched them. Number 4, carry alcohol-based hand gel to wash your hands when you've been in public. 5, wash your clothes, towels, and bedding with a small amount of bleach in hot water and use a hot dryer, which can help kill germs. Number 6, when traveling and staying in hotels, carry disinfectant wipes or disinfectant spray in which to clean frequently touched surfaces, light switches, TV remote, telephones, the nightstands. Again, you don't know who's been in there and what they've been touching. And here's my personal bonus. MRSA has been found on the tray tables in airplanes. I always bring a baggie of wipes with me and disinfect the seatbelt and armrests and the headrest, and I avoid using the tray table. Well, obviously, there's more to know about MRSA. Today, I wanted to highlight some of the facts, and this is not to scare you, but to prepare you. Be mindful of good hygiene, both in and out of the hospital. The best advice your mother ever gave you is to wash your hands and don't share personal items anywhere. Even hairbrushes and makeup have been found to harbor MRSA, so be mindful. Tell your children and grandchildren who may play sports or share lipsticks. Now, if you want additional information, I have a friend, Janine Thomas, a MRSA survivor from Illinois. She has a wonderful website called MRSAsurvivors.org. Also, I will post this audio segment of what you just heard on our website so you can listen to it again or share it with your friends and loved ones. Remember, it's MRSA Awareness Month. Help spread the word, not the germ. Go to speakupandstayalive.com for more information and ask everyone to wash their hands before touching you. And with that, let's hear some legal news you can use. We received a legal question from one of our listeners last week, and I think it best that we get the right answer from our friends at Schraff & King. So let's get Allison on the phone, a smart and friendly attorney who always takes the time to help.
Schraff & King, this is Allison.
Hi, Allison. It's Pat from Speak Up and Stay Alive, Patient Safety Radio.
Hi, Pat.
We have a quick question for you. Do you have a moment?
I always have a moment for you.
Yay, thank you. Anonymous wrote, what is the difference between a medical power of attorney and a financial power of attorney?
The medical power of attorney appoints an agent to make strictly medical decisions. Those decisions can range anywhere from whether or not to have a simple treatment performed all the way to end-of-life care. The financial power of attorney, which we often refer to as a general durable power of attorney, is a document in which you name an agent to handle your financial affairs. Those may include paying bills, signing checks, signing tax returns, anything that you may be able to do as an individual with respect to your finance. You can grant an agent the authority to do that in a financial or general durable power of attorney.
Well, thank you for taking such good care of our listeners.
Thank you, Pat. I'm happy to help.
If you have not taken care of your advance directives, write this number down and get it done today. Schraff & King. Give them a call at 440-585-1600. They are conveniently located on Som Center Road, just south of Route 6 in Willoughby Hills, Ohio. Or visit them online at schraffking.com.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rulo.
Hey, Jerry. Even though you think you're really cool and invisible, smart hospital patients know that you and your buddies hang out all over the place. What am I talking about? Oh, we know your hiding places. Doctors' lab coats, privacy curtains, the TV remote, bed rails, and even hospital pillows. My friends know not to bring their favorite pillow with them to the hospital and then bring it back home. You'd just love to hitch a ride and get out of the hospital, wouldn't you? Well, if we must bring a pillow, we bring a cheap one and leave it at the hospital as a parting gift. No cross-contamination here. For more hospital safety tips, visit speakupandstayalive.com. So ha ha ha, Jerry, we're not sleeping with the enemy anymore.
Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayalive.com.
Brought to you by Generation America, the smart and traditional 50-plus membership organization. And they provide a full range of benefits to members. If you're looking for quality Medicare supplement, their rates are lower than the other 50-plus organization, Generation America. To join and to find out more, visit generationamerica.org.
You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau, and I am always thrilled to have this particular guest on the show today. She is my friend and patient advocate extraordinaire. She is Hari Khalsa. You've heard her on the show before as a weekly guest expert. Hari is the owner of Healthcare Whisperer, a healthcare advocacy company based in Massachusetts. In her role as a healthcare advocate and as a family nurse practitioner, Hari has direct experience in navigating the healthcare system in order to find patients the best possible healthcare. Now, you don't have to live in Massachusetts to receive help from Hari. She works with folks from around the country, and there's many things she can help you with. If you have issues with talking with your doctors or getting answers to medical questions, resolving billing issues, appeal claim denials, if you need explanation of your treatment plans, managing Medicare insurance, selecting safe senior housing and rehab, Hari is the gal for you. So as you listen to her today, think about who you know who just might need Hari's help. And with that, welcome to the show, Hari.
Well, thank you, Pat. Thank you for that great intro. It's always nice to hear good things about yourself.
It's a reaffirmation after a long day that you're on the right track, correct?
Yes. Thank you. I need that.
Good. Well, by the time you're done here, you'll be a happy girl.
Okay, good. That's what I need.
All right.
Let's go, Pat.
Do it. Last week, I was a guest on Hari's Blog Talk radio program, and we had the best time wandering all around the patient safety minefield. And then later in an email, we headed over to the subject of HIPAA. And Hari, you wrote something, you said, and I'm going to share it. Today, I spent part of my day in HIPAA hell at such and such a hospital because the bureaucrats think they are protecting a patient by denying me access when in fact they are causing harm. You should do a Don't Let the HIPAApotamus Sit on You show, and here we are today.
Right.
So, Hari, can you save us from the HIPAApotamus and start by telling us what is HIPAA, what do those letters stand for, and what, on a good day, does HIPAA aim to do?
Okay, well, HIPAA is a law, and it's the Health Insurance Portability and Accountability Act. And now the hardest thing with HIPAA is every time I go to do the acronym, it should be HIPAA. I often find myself doing HIPPA. So just to let everybody know, if you see HIPPA, it's probably the same thing, generally. But HIPAA was originally enacted into law to protect people, to protect the patient. It was written to give patients rights and to protect their medical records and their private protected information. It actually grew out from the seeds of a representative in Congress who had either, I'm not sure if it was a sibling or a child who had mental health issues. And those mental health records were not being protected, and everybody was finding out about their loved one. So he became so enraged that he really took this to task. And it evolved into protecting everyone. So that's how it actually started. And in all sense, when it first started, it was really, I was actually really excited, and there are parts of it that I still really, really like. It was a way to protect your information, but it has become very cumbersome.
Well, is it the actual law that's cumbersome, or is it the fact that people interpret it incorrectly to cover themselves? I know that the penalties for violating HIPAA rules are severe and can range from, say, $100,000 to $50,000 per violation up to $1.5 million a year, and can even carry criminal charges, which could result in jail time. So, this is serious stuff. So I'm thinking, with that in mind, it might be easy to understand how a healthcare provider, if they have any doubt as to whether or not their sharing of information might be construed as a violation of HIPAA, that they will err on the side of safety for them and not you as the patient. Is that a fair thought?
Yes. yes, the penalties are harsh, and they're harsher in the world of computers. When this law first started, it was really paper. It was a paper trail, and it was about getting your paper records. But the law itself has, it's both when you ask the question. I mean, it is the interpretation and it's the actual law. There are so many parts to the law that can be very confusing, and as with so many laws in our country, as they begin to be enacted, they get interpreted. And everybody, when this law came out, everybody in medicine, from the doctor to the person copying the notes to the medical device people to pharmacies, anyone who has anything to do with medicine, any aspect of healthcare, had to understand this law. So not just did it become cumbersome, there was a whole new department of HIPAA law that was developed, and hospitals and law firms have people that are specialists in that. So whenever there's an issue, it can often end up going to the lawyers. Mm-hmm. So, yeah, that's how cumbersome it can be, when, in fact, all it really is supposed to do is provide a way for you as the patient to decide, A, who can look at your information and when they can look at it. And it also says you have the right to get copies of any of your information at any time. What the law also provided an avenue for grievance and complaint. And that's important for people to know, because a lot of times that's the only way. And that avenue is through the Office of Civil Rights. Again, that can be cumbersome because it's regional, and you have to really push for that. It used to be in the early days, every state had their own department, but that's been taking off the books, and it's in with the Office of Civil Rights. So it is really hard for patients at times. It is cumbersome. And and for doctors, they don't want to get sued. We're back to that. Anything they're going to protect themselves, so they're going to err on the absolute conservative side of caution.
So we're talking about that privacy piece of paper, am I correct? So we go to our doctor every time we go, or to the hospital, they shove all those papers and you sign them, and they're called privacy acts. And then there's the HIPAA papers, and half the time we don't even know what we're signing. What are we signing? Are those HIPAA? And should we sign them?
Well, that's two questions.
Well, come on, hurry.
Really, there's a standard form. And should we sign them? I say read them. I have a wonderful client who, a lot of times what they do is you'll go to the doctors. I mean, if you go to a specialist, and here's the HIPAA form, sign it. And we look, okay, sign it. We're like a sheep to slaughter,
yes.
And so, okay, I'll sign it, because we hear HIPAA, and it's just like so in our vocabulary, and the doctors talk about it. Oh, did you sign the HIPAA form? Oh, yes, I signed the HIPAA form. Well, I have a client, and she does this with all her informed consents also. She actually will take as long as she wants and reads it. And you know what? If she doesn't like a sentence, she crosses it out, and she puts in what she wants there. So in the HIPAA form itself, what this HIPAA form, especially when you go to a doctor's office, what that's allowing them to do is to talk to other doctors. And you actually have the right, and to talk to the insurance company, to any other person involved in your care. You actually have the right to say no. You can't, or to say them, you can talk to this person. You can talk to this specialist, but you can't talk to my counselor.
Interesting.
I see that a lot. And that's people's right. Or no, you can't talk to anyone. You have to call me first and ask.
Oh, okay. So they can't refuse care if you say, no, I'm not signing that.
No.
Okay.
No.
Okay.
No.
All right.
No.
All right. What are you finding in your practice that the HIPAA laws are impeding you from helping your client?
I have a business HIPAA form, and it's actually taken from the federal government's, the Health and Human Services website, the standard. There's standard things that have to be in the form, and every form has to have these. What I find is in a lot of places, especially in big institutions, they'll say, well, we can't accept this form because it's not ours. Now, that's where the line is gray. Although the law says that they can decide what their form is going to look like. All a form has to have is all the information that the federal government requires. What happens is that institutions put layers on it. Every institution, by law, every practice has to have what we call a HIPAA compliance officer. And that's someone who decides what's right and wrong or knows the law well enough to be able to say no, no. Or when I get that kind of response, then I go to the person who's going to actually be able to interpret the law and know it. And I know that as an advocate. I know what to do and where to go. Mm-hmm. And, the interesting part that I find is that on all the HIPAA forms that are in the hospitals are not real HIPAA forms. They're only HIPAA forms to get medical records. They don't have a HIPAA form for just conversation. Mm. Because they always come back to me and they say, well, you have to go to medical records, and I kind of have to inhale. I go, inhale, Hari, exhale, Hari. And I say, no, I just want to talk to them. See, this says I can talk to you, too. Right. So those are kind of some of the just day-to-day problems I have.
So you're finding this as a patient advocate for someone else that you're not related to. Let's say we have a listener that has a family member that wants to be able to assist a parent or, a grandparent or whoever, and they want access to some of this supposedly private information. Can they be denied, or is there a HIPAA paperwork that needs to be signed in that kind of an instance?
Right. Anytime you're not the patient needs to okay that you can see it. If the patient is incompetent, mm-hmm. then you just don't need a HIPAA form. You need to show them the power of attorney, that you have power of attorney to get it. Even when somebody passes away and a spouse goes to get the medical records, they will deny them until they have to verify that they were married to the person.
So the privacy continues into death.
Yes, that was the exact words that was used.
Oh, okay. So what do we as patients need to know about our rights, say, if we feel like we're unreasonably refused access to our records or information or an appropriate family members? What can we do? Secret words here?
All I would say is if you fill out their form, and usually if you have a hospital, there's a form, and you list the names of the people, then they should give it to you. Now, if they deny you, what I do is I say I want to talk to a supervisor. That's really the only thing that's going to happen, because sometimes people on the ground behind the desk at the medical records, they're just saying, oh, I can't accept this, or who knows why they do it. You can always say I want to talk to the HIPAA compliance person, because if the form is correct, they have no grounds to deny you. I mean, I've had a situation where a client was at a hospital, the significant other was in the hospital. They wanted to transfer. They needed the medical records immediately, and they were being denied. And it wasn't until I actually talked to the director of patient services that I was able to get those medical records released. And and she agreed there was absolutely no reason why they hadn't been given the records.
Right, and sometimes time is of the essence. I mean, if you have a medical crisis or an emergency, you don't have time to be fooling with this kind of thing. Do you think it's helpful for our listeners to have their advance directives like a healthcare power of attorney, and would that solve some of this problem?
Well, for people that are incompetent or the healthcare proxy has been invoked,
right,
definitely.
Okay. All right.
I tell people carry that around with you. Anytime you're in the hospital, healthcare proxy, power of attorney, those are like vital, and a medication list, those are vital information to always have with you.
Good advice, good advice. Are we missing anything else our listeners should know about HIPAA? I know there's so much to know, but anything that we're not covering that you can think of?
I think you have to know, don't fall for, well, we're protecting the patient. No, you're not. If you are the family and you have the form, then they're not protecting the patient. I don't know why they're doing it.
I want to take a real brief sidestep. I want to talk briefly about the October 1st insurance exchanges. I think even the powers that be don't understand them. I just want you to explain to our listeners, can you help our listeners figure out what might be best for them? So if we have someone who's thinking they're going to go online October 1st and figure out what might be in their best interest, and they have no idea, silver, bronze, gold, pink, purple, whatever, can they call you, and how can you help?
Yes, they can definitely call. What I can do is help, look at what state they're in, what their zip code is, find out what they're looking for in insurance and the parameters, and then look at the insurance and help them figure out what might be best for them. And it's easy for me to do because I understand what I'm looking at.
Right, and that's what I'm looking for. We, as lay people, sometimes have no idea, and like you say, it seems to be a very confusing time and situation. So I would ask our listeners, if you think that you need professional help in taking a look at the insurance exchanges, Hari is available. And Hari, can you tell our listeners how they can contact you?
Sure. My phone number is 866-980-4325, and you can email me at HEAL, HEAL, at healthcarewhisperer.com. And I look forward to hearing from you and love helping people with insurance issues.
I know. You are awesome. If our listeners have any questions about anything related to patient experience, doctor questions, referrals, billing issues, you are the go-to person. Hari, thank you for being on our show every week, our weekly guest expert, and for spending this much time with us today.
Thank you so much for having me. I really appreciate you allowing me to vent on HIPAA.
Hari and the HIPAA, thank you for saving us from the HIPAApotamus.
Right, exactly.
Right, thanks, Hari.
We interrupt our program to bring you a special broadcast.
Let's spend the next 2 minutes with our resident cleaning and infection preventionist, Daryl Hicks, nationally recognized as one of the top experts in infection control, as well as author of the book, Infection Prevention for Dummies. Daryl, when hospital housekeepers clean a patient's room, is there a cleaning pattern that they follow?
We trained housekeepers to clean from the top down because of gravity. If you dust something, then that's going to fall to the floor or other horizontal surfaces. So clean things from the top down and from the cleanest part of the room to the dirtiest part of the room. We consider the restroom being the dirtiest part, so that should always be the last area of the room that is cleaned. If you have a housekeeper that comes in and cleans the restroom before cleaning the patient's room, that's a red flag that you need to question and don't allow them to clean the patient's room until they have changed gloves, changed their cleaning cloths and what have you. But we consider the zone around the patient's bed, that 36 inches, to be the most crucial part because that's what the patient touches. That's what the caregivers, nursing, doctors, they all touch the bed rails and over bed tables. Those kinds of high-touch surfaces right around the patient's bed should be thoroughly cleaned and disinfected on a daily basis. And then whoever is coming in and out of the room, most hospitals provide a disposable disinfectant cloth and always encourage patients and their visitors to wipe those things because not everyone is as conscientious as they ought to be when they come in and lower the bed rail, administer medications. Be diligent about keeping that zone right around the patient's bed as clean and disinfected as possible.
Excellent advice. And I always tell my folks, if you're visiting someone in the hospital, don't just sit there. Clean.
Good advice.
Yeah, I learned from you. Well, before you go, Daryl, where can everyone order your book?
It's DarrellHicks.com, DarrellHicks.com. My number is 314-956-1177.
So Infection Prevention for Dummies is a free 48-page pocket-sized handbook, so I encourage everyone listening to get this free book. There's a small shipping and handling charge, but for a free book loaded with this kind of information, it's a must-have book, folks. Well, thank you so much for sharing your years of experience with us today. We just love having you on the show.
Thanks, Pat. I like being here, and thanks for inviting me, and thanks for the work that you do in keeping people safe.
You're listening to Speak Up and Stay Alive RadiOh. I am your hostess, Pat Rouleau. So happy to spend this hour with you to help you survive any healthcare or hospital encounter. Well, folks, the boys are roaming the halls with their ice cream cone-shaped squeaky dog toys in hand. I guess that can only mean one thing. They are ready to head over to the game chamber to play the silliest game ever, Squeak Up and Stay Alive. Here's how it goes. I will read a question from our squeaky question chamber, and Bob and Jeremy will squeeze their squeaky toys when they think they know the answer. The first one to squeak will get the chance to pick the next category of questions with the hopes of winning the grand prize. The winner gets to keep their ice cream cone-shaped squeaky dog toy and the fabricated championship belt. Bob has laid claim to the chocolate cone. Let's hear your squeak. And Jeremy has the vanilla. The best little squeak ever. And folks, these cones even have sprinkles on them in the shape of dog biscuits. So are you radio rivals ready to play everyone's favorite game, Squeak Up and Stay Alive?
Ready and willing.
Let's get it on.
Let's do it. Here are the categories: healthcare acquired infections, when dangers are strangers, and the grab bag. So today, Jeremy won the pregame toss, so he begins. What category do you want?
You know I like this one, so let's start when dangers are strangers.
Okay, here we go. The Squeak Up and Stay Alive question, number 1. When this danger is a stranger, a patient will develop a small tear in the skin that can quickly become this. Bobby.
Oh, that's definitely a bed sore.
Yes, also known as a pressure sore or pressure ulcer, making it so important to change positions often, at least every 2 hours. All right, Bobby, you get the point and choose the next category.
Well, since it's such tough questioning going on here, let's go to the grab bag.
Okay, the Squeak Up and Stay Alive grab bag question number 2 is a true or false. The coronavirus comes from drinking too much beer and causes random visions of life on the beach. Jeremy.
Oh, don't we wish, but sadly I will say that is false.
Oh, obviously that is false. This new coronavirus was first identified in September of 2012. And a patient who died from a severe respiratory infection. The virus shows up with a fever, cough, shortness of breath, and breathing difficulties. And at this point, it's not clear whether this is typical or whether it could be circulating more widely. So remember, Jeremy, wash your hands often.
Busted.
All righty. You get the point, Jeremy, and choose the next question.
All right, I'm going back to it. When dangers are strangers.
All righty. The Squeak Up and Stay Alive question number 3. When this danger is a stranger, your current nurse will be replaced with a new nurse. And this dangerous time is called a shift change, or is better known as what, Bobby?
Oh, I didn't mean to squeak. I'm not sure.
Okay. Well, Bob, it's called the handoff, a time when miscommunication will most likely occur. Anytime information crosses lines, either between people or location, this is an important time for the patient advocate to be available and on site to see to it that the proper information gets transferred. All right, guys, no one gets the point, and Jeremy controls the category. What do you want?
Back to me. I'm gonna go back to the grab bag.
All righty. The Squeak Up and Stay Alive question number 4. When healthcare providers repeatedly enter the same data day after day into a patient's chart, this is called... Bobby.
I do know this one. Sloppy and paste.
Sloppy
Really?
and paste, yes. Instead of entering current and accurate data, many lazy providers get sloppy and cut and paste previous information into the chart in an effort to save time. This can be very dangerous to the patient's health and outcome. Always check your medical records. You have that right. Bob, you get the point and control the category.
Go to the grab bag.
All right. The Squeak Up and Stay Alive question number 5. There are state and federal laws that protect your right to request what? Bobby.
Oh, I jumped on that one real fast. That's your medical records.
Yes, copies of your medical records and test results. So please, folks, take advantage of this right and ask for copies of everything. Check to make sure your information is correct. So Bob gets the point and chooses the next category.
I think I'm going to go back to the healthcare acquired infection.
All right, mixing things up again. Here we go. The Squeak Up and Stay Alive question number 6. An infection that occurs after surgery in the part of the body where the surgery took place is called... Jeremy.
A potential lawsuit? No, just joking. Sounds like a surgical site infection.
Yes, it is a surgical site infection. And by the way, Jeremy, medical malpractice lawsuits are not fun.
Oh, okay. I'm learning.
Surgical site infections can sometimes be superficial infections involving the skin only. Other infections are more serious and can involve the tissues under the skin, organs, and implanted material. Always keep an eye on any part of the body where the skin has been compromised. So, Jeremy, you get the point. And guys, the score is Bob 3 and Jeremy 2. And with such high stakes, our fabricated championship belt, you better sharpen your pencil, Jeremy, or Bob will win 2 weeks in a row. Let's get to it. You radio rivals and Jeremy, choose the final category.
All right, this is tough, but I'm going to go back to the grab bag.
Okay, get your squeakers ready, because here is the final question. The Squeak Up and Stay Alive grab bag question number 7. It's a true or false food safety question, Jeremy. Tomatoes that are leaking should not be eaten. Yeah.
All right, I'm not sure what the real answer is, but I wouldn't eat a leaky tomato, so I'll say that is true.
What about a leaky tomato? Would you eat that?
No, you know what? Still not going to do it.
Okay. Tomatoes go bad before you actually see the mold. They sort of collapse and leak their fluids. Food safety is a very real concern, and today's food supply is becoming a dangerous health risk. Thanks to genetically modified foods and secret ingredients not required by the FDA to be disclosed. I think we're going to have to talk about this on a future show. Well, it looks like we have a tie. You did it, Jeremy. Do either of you have anything to say about that?
We'll just have to meet again next week.
That is a date, then I will be there and ready to get my belt.
All right. Should we hang the belt on the back of the wall till next week?
That seems fair.
All right, we'll hang it on the wall. All right, guys, you're both winners, though. Think of how much more you know about being a safe patient. And our listeners are winners, too. Thank you, guys, for playing our exciting game of Squeak Up and Stay Alive. Let's give ourselves a round of... Yes! So remember, the point of this game is the squeaky wheel gets the grease. Or in this case, the squeaker gets the prize. So feel free to speak up or squeak up at every doctor visit or hospital visit. That's the best and only way to get the attention and service you deserve. Coming up, more of what you've come to expect from America's favorite healthcare and hospital survival radio show, Speak Up and Stay Alive Radio.
That was very fun. I love this game.
Listen while I spend the next 2 minutes with Chris Alberta, the Medicare supplement partner with Generation America. Chris, today, let's talk about something for free. Everyone loves something free. You offer a free Part D analysis when it comes to the Medicare supplement plans, which is prescription drugs. Can you explain that to us?
We have talked to so many Generation America members who have Part D plans that they've purchased in addition to their supplement, which covers no prescription. And what we find over and over again is that somebody is on a plan that really has not been customized to the drugs they're taking. Maybe they bought it because they saw it advertised heavily on television, but in many cases, they're buying it because it's got a cheap premium. Anybody, whether or not they have a supplement or an Advantage program through us, can submit their drugs online. We have a beautiful RX portal set up. And they'll get back, typically within about 48 hours, a recommendation for the Part D plan that will cost them the least for 2014. That includes the premium, it includes the copays, and overall, I see people save $1,500 to $2,000 by being on the right Part D plan.
Oh, that's crazy. So no matter whether our listeners have their supplement with you or with someone else, they can contact you. How can our listeners do this? Where should they go?
Well, they can log on to generationamerica.org. The boob can be found under the Insurance tab, Senior Health Direct, and they just start filling it out. And if they get stuck, they can always call the 800 number that's specific to Generation America, and we'll answer and kind of walk them through the process. But it's pretty self-explanatory.
Excellent. Do they need to be a member of Generation America to take advantage of this?
They don't, but I'll tell you what, I mean, anybody who goes through this process, Pat, and can kind of see the value, I mean, Generation America has gone so far above and beyond what we normally see from advocacy associations, that if they go through this process and save all that money and don't think, man, this is an organization I want in my corner, I'd be shocked.
So, folks, visit the Generation America website. It's generationamerica.org, or you can reach them by phone, 877-687-4362. Thank you for sharing that with us today, Chris.
Hey, no problem, Pat. We'll talk soon.
Thank you.
We were surprised when Dad brought up hospice care. I thought you called when you were all out of options, but Hospice of the Western Reserve has been helping care for Dad for some time now. I'm so glad we called when we did. Their support has given us quality time I'll remember forever.
With Hospice of the Western Reserve, you can choose when, where, and how you receive care. Discover why the hospice of choice is Hospice of the Western Reserve at hospiceofchoice.org.
Hey guys, someone just called the studio and left a phone number but no name. Will you call the number back and see what they wanted? Thanks. Hello, who is this?
I'm Jerry the Germ.
Oh, hi Jerry. Do you know who this is?
Pat Rulo.
That's right, from Speak Up and Stay Alive, Patient Safety Radio. How often do you listen to the show, Jerry?
Every Saturday morning.
Well, I'm glad to hear that you're a loyal listener, but you sound a bit stuffy. How are you feeling? Oh my, you must have caught a germ from one of your germ friends. Are you taking any medications? And if so, how many per day?
From 9 to 10.
Oh my, that's a lot. How many different pharmacies are you using?
From 7 to 8.
Wow. So you called earlier. What did you want?
The Speak Up and Stay Alive Healthcare and Hospital Safety Snippet.
Okay. Here's one just for you since you are taking so many medications. To avoid dangerous drug interactions, get all of your prescriptions filled at one pharmacy or at the same pharmacy chain. That way, the pharmacist or their computer system can flag any dangerous combinations. When you use multiple pharmacies like you're doing, no one knows what you're taking, and the chances of mixing inappropriate drugs with one another increases. Come on, Jerry. You're a big promoter of the show. What is it that you always say?
Stay safe. Listen to Speak Up and Stay Alive RadiOh. Tune in every Saturday morning. For more information, go to speakupandstayalive.com.
You are listening to Speak Up and Stay Alive, Patient Safety Radio. I am Pat Rulo, your hostess and author of the book Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, available at all of our live speaking events or at our website, speakupandstayalive.com. That's where you can also locate radio show times, dates, and station information. That's speakupandstayalive.com. And if you want to purchase the book but do not have internet access, it's okay to call me. Lots of folks order the book this way. Give me a call, 440-725-5462. Well, today we talked about MRSA because October is MRSA Awareness Month. And as I mentioned earlier, if you would like to hear that segment again or share it with someone, it can be found on the website, speakupandstayalive.com. And our guest, Hari Khalsa, the healthcare whisperer, talked us through the HIPAA laws and how they are supposed to protect our privacy and not inhibit our care. If you have any questions about HIPAA or anything related to the new health insurance exchanges, she is the gal to call. And here's her number. Grab a pen. 866-980-HEAL. HEAL. That's 866-980-HEAL. Now, if you missed some of today's show, it's not too late to hear it all. You can go to the radio link at the speakupandstayalive.com website and click the link with today's date. That's where you can also purchase the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide. If you want extra special treatment during a hospital stay, you need to stand out, but in a good way. Take the book with you to the hospital or bring it as a gift to a friend in the hospital. Lay it on the tray table, and just from the cover alone, it will generate such positive conversations with the healthcare staff. Now at a glance, they know that you are an E-patient. And E stands for empowered, equipped, educated, and eager to get out safely. Now, you don't want to come away with any regrets. Remember last week when I talked about the hindsight triplets, shoulda, woulda, and coulda? Find out what you need to know and feel safe speaking up. Armed with the information in the book, you will at least have a roadmap to a safe hospital journey. So if you don't have a copy, I really do encourage you to have one. You can get it at the website, speakupandstayalive.com, or call me, 440-725-5462. And let me take a moment to thank all of our radio sponsors and weekly guest experts, because thanks to them, we are here, and that helps keep us safe. I really encourage you to support these fine folks, and you can find their information at the speakupandstayalive.com website. Well, by now you know that when it comes to learning about patient safety, this radio program pulls out the stops to share only the best and the brightest minds with you, our very important listeners. And if you have a topic of concern or interest and you would like to perhaps have me address that within the show, I would welcome your thoughts. Email me at speakupandstayalive.com or call 440-725-5462. And next week, you absolutely must tune in. I have John T. James, the chief toxicologist from NASA, the Johnson Space Center in Houston, with us to talk about his brand new findings about the number of people harmed by medical errors each year. This is a groundbreaking study that you must know about. And I've said this before, but you will not find these kind of guests on any old radio program. We attract only the brightest and the best just for you. So share this with your friends, your families. Wear a big sign and stand on the street corners and tell everyone to mark their calendars and set all alarms for when? Oh, you know when. It's next Saturday morning, where you can find us in Cleveland, Ohio from 7 to 8 Eastern on AM 1420 WHK and from 9 to 10 Eastern on AM 1220 WHKW, as well as from 9 to 10 on AM 1440 WHKZ. Or you can always listen live via the internet. Check the SpeakUpAndStayAlive.com website to find out how. Start your week with an O. Speak Up and Stay Alive Radio. And until next Saturday morning, I hope you have a healthy and a happy week. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem and should not be considered as medical advice. If you've missed part of today's show or just want to share the information with friends, you can listen to all of Pat's previous shows at speakupandstayalive.com. Want even more information? Purchase a copy of Pat's book at speakupandstayalive.com. Once again, it's speakupandstayalive.com. Or you can call Pat at 440-725-5462. Until next week, remember, it's okay to ask others to wash their hands. You have to speak up and stay alive. Brought to you by Generation America, the smart and traditional 50-plus membership organization. And they provide a full range of benefits to members. If you're looking for a quality Medicare supplement, their rates are lower than the other 50-plus organization, Generation America. To join and to find out more, visit generationamerica.org.